Awesome. Please let me know if at any point you can't hear me. Today, I'm not even working with any earphones. So I think it should be just fine. Ms. Victoria had to see patients today, so I am leading her night. So she was so sad. She's like, oh my gosh. All right, so we're gonna get started, and thank you so much again, and welcome to our third day of our CNA State Prep study session. For those who have joined us throughout each day, I hope that it's been helpful and it has allowed you to think through questions, test taking strategies that may help you eliminate and select the correct answer. And when in doubt, if you don't know something, I always say, ask the question a question. What is it asking me? And sometimes that question that's going to give you the biggest clue, it may be the second part of your question. All right, so let's get started. All right, so we've already talked through our programs. For those that are going to be new to us as a school, we are located in San Marcos, Texas, in the Central Texas area. And we provide CNA training along with these other programs. And our programs average from 4 to 12 weeks. Our healthcare programs are mainly hybrid, meaning that they're partially online, partially in person. And some of our programs are primarily online, like our medical assistant portion of our dual certification. We also offer HVAC technician training, which, if you think about it, what are the two most essential skills and people we need is healthcare, and we need some AC, right? So we can't go wrong. Please check out our website and just get familiar with us. And if you're in our specific area, we would love to have you. And if you are part of other schools and other of my colleagues, congratulations to you, and utilize their school to be able to continue to add more skills to your skill set. All right, so we actually added a few more test taking strategies, and we want to thank Ms. Victoria for this. So we've talked about my most common things is number one, we're going to read all questions at least 3 times. Then we're going to add Ms. Dulce's a recommendation, which is to start with reading your answers first, then the question. I don't have that listed, but that's something that she said really, really helped her. Also, my favorite is ask yourself, what is the question asking? Because a lot of times you may overthink and you may add more to the scenario or question, and then it totally confuses your process. So take a deep breath. When that happens, ask yourself, what is this asking me, right? Number 3 is to eliminate obvious incorrect answer choices. We don't want our brain to focus on nothing that is obviously not correct. We want it to only focus on the possible 2. And if you can get it down to the correct answer fairly quickly, then we want to select that. This is an addition from Ms. Victoria French, one of our other CNA instructors. She says, try to focus on answers that promote safety for you and the resident, proper hygiene, infection control, resident independence, and always tell your nurse. So I really like these nuggets that she added to our test taking strategies for the CNA exam. Because safety is first. And as we worked through a lot of safety questions yesterday, it is a little challenging at times to figure out what is the best response. 100% of the time, the answer is always wash your hands before you do any care task. And that is when in doubt, yes. Sometimes, some of these test taking strategies, it's not always, but if you're ever in a scenario on your test and it's asking you, should you wash your hands before or even after the task, 100%, it's going to always be yes. There's not a scenario that I can even think of that we wouldn't do that. So I thought these were some great additions by Ms. Victoria French. All right, let's get started. We're going to use the chat box as we did before, and every so often I may implement some of those test taking strategies, do some definitions if you need things to be clarified. Again, this is the opportunity to honestly challenge yourself, but also get it wrong so you can know what's right. There's nothing wrong with trying to figure it out. That's what study is all about, and that's how you prep to pass your test. So our first question says, when a physician issues a DNR order, it means that a resident should not be resuscitated. B, the resident's family must be asked if they want the resident to be resuscitated. C, a doctor must be called before resuscitation is performed. Or D, the resident's attorney must be contacted before resuscitation is done. So I want you to put your answer choices, and or if you want me to clarify a word, please let me know in the chat box and I would be happy to do that. All right, we got some answer choices. So y'all actually came to a conclusion. A, right? That is so important. We know a DNR means do not resuscitate. And for those who are like, what is resuscitate? I'm having a brain fart. It means that we will not provide CPR. This resident has made a decision along with their family members. And they're wanting to have control over what happens if their heart stops. And in this case, they're choosing a DNR. So we have to follow that document. It is considered legal and binding. And during our CPR class, we talked about it doesn't matter if the family feels different about it at the time, unless that DNR is removed and discontinued, we still have to honor the request of that resident. So very good. Protected health information includes A, the number of visitors a resident has on a weekly basis. B, a resident's personal financial information. C, a resident's personal preferences regarding roommates. Or D, a resident's voting history. What say you? All right, we got an option on the board. Okay. Any clarifications or needing me to help with knowing what a word is or anything like that that may help? All right, so we got B. Awesome. Two B's, let's go. And it is a resident's personal financial information. So I think all of the other answer choices were pretty obviously wrong. And it also said protected health information. So there's nothing really addressing protection of that person's information, but that one. Perfect, very good. All right, boy, these words are big, aren't they? The term scope of practice relates to A, the task a family member can perform for a resident. B, the services that a religious leader is allowed to provide to a resident. C, the task a healthcare provider can legally perform. Or D, the responsibilities an administrative assistant can carry out during a shift. What do you think? Awesome. Y'all are just rocking it out today. C, the task a healthcare provider can legally perform. Love it. Very, very, very good. Some of your questions are going to be knowledge-based questions. And this is an example of that, meaning, do you know what this is and what this means? Even the last question, when it asks for personal healthcare information, it's a definition question, right? Do you know what that means? Why would the state ask this type of question? Because they're going to probably ask you a question that has you decide, is this within the scope, which is the legal thing that a CNA can do, or is this something that maybe a nurse should do? So these are like knowledge-based questions. If you don't know, like the word scope of practice, this would be one of those Googleable, Google wanted situations, or look at your textbook to define it, right? But you're both correct. And it has to do legal. It has to do with legal. One of my best examples of this is we don't want, let's say, a knee surgeon to work on our hearts, right? Legally, yes, they're both doctors. They both went to school. But do we want a doctor that works on the knee, working on our heart? No. We want him or her to work in the context of the law that is allowed based on the knowledge and education that they have. Awesome. All right, Miss Ann tells the CNA to change her wound care bandage. What should the CNA do? A, tell the resident she should change it herself. B, inform the resident that she's unable to, but she will let the nurse know it needs to be changed. C, call the resident's family. D, document the resident's request. Very, very good. I would be so worried if anybody said A, right? Like, why are you being a CNA? So B is the best answer. Inform the resident that she is unable to, because guess what type of question this is? It is a scope of practice question. So that first one right before that asks you to define it, like what is scope of practice? Now it's testing you, do you even know what your scope of practice is in this scenario? And you're correct, it's gonna be B, because providing wound care is a nurse task. It's a nursing task, not a CNA task. Awesome. So our next question is, a resident had an accident on herself while eating in the dining room. What is the CNA's best action? A, tell the resident in front of the others that she has soiled herself. B, ask the resident if she can walk to her room with her. C, ignore the incident because the resident is having fun. Or D, inform the nurse aide that is responsible for the resident. So what say ye? All right, so I love this. So we have two different answers. So we have B and D. That's correct for everybody. You got B and D going here. So let's look at it. All right, the resident had an accident, so that means that they've soiled themselves. Maybe they had a bowel movement, or they urinated, they voided, and they're in the dining room. So it's a very public situation. The resident is eating at this time, but you as the CNA have noticed it. So the question is asking us, what is the best action? So how do we promote dignity in this situation is really what it's saying. Like, which answer is more embarrassing? Which answer is maybe removing the privacy of that resident? So that's something to think about. So let's process it a little bit. Let me get my drawing too. So A says, tell the resident in front of others that she has soiled herself. So I made sure that we put something very obvious here, but it could say like, tell the resident that she soiled herself. Like, is that appropriate in the dining room? Are we giving out very personal information in front of others? Could it be seen as embarrassing? Are we preserving the dignity of this person in this scenario? We're not, right? We're not dignifying them. We're not honoring them. So we're gonna eliminate A because it will be embarrassing, right? And this is even for a resident that may have a diagnosis of Alzheimer's or dementia, because I think sometimes caregivers can dismiss how a resident may feel because they're confused. We still want to treat that resident with respect and dignity, even if they don't know what time of day it is. They're still a human being. All right. B, ask the resident if she can walk to her room with her. So we're going to do a process of elimination, and I'm going to say, let's keep B. That's an option that you put in the chat box. C says, ignore the incident because the resident is having fun. Now, C may not seem too bad, but the reality is the resident is visibly soiled to the point that the CNA noticed it. So that means other residents can notice it. And anytime a question is asking me like to ignore something that is within my scope of practice, it's probably not the right one. Just the whole ignoring makes it not feel right, right? Because we shouldn't ignore things that could impact our residents. D, inform the nurse aide that is responsible for the resident. So we're going to keep that one. And I can see why this one we have B and D. So let's think about what is the quickest thing that we can do. Put that in the option. Is it B or is it D? What do you think? What is the quickest thing that we can do to support this resident in this scenario? Let me see both of your options. What say you? Quickest thing to do. Awesome. We got B and we got B. That is correct. So remember on yesterday, we talked about priority questions. Also, what is the best response, initial, first thing to do. So D is not a bad answer. Let me just say that, because what we're saying is like, okay, I noticed that Mrs. Smith, who is assigned to Laura, is wet and they had an accident. I'm going to inform Laura, her CNA, that this has happened, right? So that's not really a bad response, but best is a good way to think about it. What is the best thing that I can do for this resident in this situation? And it's going to be B. I'm going to just assist the resident, right? It doesn't matter that Laura's assigned to her. I'm the first one that noticed it. And even though, yes, you will have assigned residents, everybody's responsibility. That's my motto, right? And just give a more, what is the word? Like a more evident answer. Let's say we had walked in and this resident was on the floor and we weren't assigned to that resident. So would we then go call the CNA, right? And say, hey, Mrs. Smith, your resident is on the floor. Or should we go and check on the resident, check for injuries, et cetera, right? So just remember that word best. You want to benefit this resident in this scenario, and it really doesn't matter who is assigned to her. I saw it first, so I'm going to respond to B as the best answer. Let me know if that helped with, you deciding that, because it did give you two good options, right? And this is why being able to think through these scenarios can help you get to the right answer. So, and obviously we're asking the resident if she can walk to the room. We're not being very straightforward, right? And saying, hey, Mrs. Smith, you're wet. We got to go to the room because we want to protect her privacy and protect her dignity. But we know that if we can just get her to walk to the room, then we can take care of her and get her clothes changed and cleaned up and bring her right back to the dining room. So we know that B is going to get us to the bathroom. So that's another thought. Very, very good. All right. A resident often carries a doll with her, treating it like her baby. One day she is wandering around crying that she can't find her baby. The nurse aide should A, ask the resident where she last had the doll. B, ask the activity department if they have any other dolls. C, offer comfort to the resident and help her look for her baby. Or D, let the other staff know the resident is very confused and should be watched closely. What are your thoughts on these options? Awesome. I love these answers. C, offer comfort to the resident and help her look for her baby. I'm so happy you came to that conclusion. D is not too bad of an answer, right? It's telling us to communicate. Let the other staff know the resident is very confused and should be watched closely. But we all know that the resident is confused, right? We can see this in the question because the resident is carrying a doll, and she believes the doll is a baby, her baby. So she's confused. That's evident in the scenario. What is the best response? And you're right, it's C. Let's comfort her. We're not going to point out and say, well, that's not your baby. That's not a real baby. That's a doll. We're not going to do that. We're going to go along on the journey with her, and we're going to provide comfort, and we're going to help her find the baby. Because guess what? She's not going to let up. So that's going to be the best response. That's going to make her feel the most comfort. And you're going to get her to calm down because now you're supporting her in this situation. Very, very good. Awesome. You are caring for Dorian, a 58-year-old resident. She becomes very angry. What is the CNA's best response? A, the nurse aide can listen closely to the resident to try to find out what caused the anger. That's A. B, the nurse aide can share some of her personal problems with the resident to distract him or her. C, the nurse aide can joke with the resident to make him laugh. Or D, the nurse aide can offer suggestions on how the resident can leave the facility. I'm laughing a little now on D. What say ye? Sometimes these answer choices are hilarious. It's like, what? What do you think? Remember, our process of elimination can help if you feel like, that way you can focus on only the thing that potentially could be correct. Also, our keyword is best. What is our best response? in this scenario. I don't know if there's a supportive section, but you know, this is one of those questions where support is exactly what we're trying to provide. Right? The resident is very angry. What can we do in that moment? What is our best response? All right. Anyone having a hard time? Okay, we got A and C. There we go. I was looking for that next option. So we have A. I'm gonna give it a good circle. And we got C. I actually like these two options. We know B is just not a good response because, you know, the resident is angry about their problems, right? So we shouldn't overcrowd or make the focus about us. And that's what B does. D, the nurse aide can offer suggestions on how the residents can leave the facility, but you know, I mean, they're there to stay, right? So that just is just a weird option. So we got our two. The nurse aide can listen closely to a resident, try to find out what caused the anger. Or C, the nurse aide can joke with the resident to make him laugh. Awesome. So I actually can see why we have both of these answers left. Because number one, you're being a good listener and you're actually trying to figure out what is the root cause. You know, did something happen? Did another resident say something? Did they not get the item at the dining table that they wanted? You know, I've seen some very interesting situations in the dining room. C, the nurse can joke with the resident to make him laugh. So even with C, there's some support here that's happening. There's some comfort. Also, if this resident typically is a jokester, I could see why the nurse aide would want to go there to try to distract them from what is making them angry. So I really, really understand why these two are there. So one way that we are going to be able to eliminate one is to think about what is the most supportive and which option is actually allowing us to potentially provide a solution, right? Because what if it was that a resident took their dessert, right? It could be as simple as us going and saying, hey, don't worry about it. I'm so sorry that happened. Let me go get that dessert. And now we've actually got to the root. What if their pet passed away, right? If we do one other option, we can maybe distract them, but after we leave the room, after we stop talking and joking, could the anger come back because we didn't get to the root cause? So now that you have a little bit more information that can help you, let me know where you land between A and C now, thinking about it. All right, we got A, so you stuck with your first answer, okay. Perfect. Martha, what do you think? I know. You're like, I don't like any one of them.
Yeah, because you say we're gonna talk about safety, and then for me to listen too close to the patient and he's
Ah,
angry, I don't want to be close to a person he's mad.
I got you. I didn't even, I didn't think about it that way, Martha. That's a very good thought. Um, I definitely when you lead with safety, I totally understand that. Um, but if you think about, I'm trying to think how else I can put it to help you with that one. The question is not saying that they're aggressive, or combative. It's saying that they just became very angry. And like the scenario I gave, I've seen residents get angry and not towards me, but towards the situation or the scenario. Like, every time I sit by Mr. So and so, he always takes my dessert, right? So they're not trying to, they're not aggressive, they're not combative, they're not trying to cause harm to me. They're just upset, they're angry about what just happened. And it allows me to figure out, okay, let me talk about changing your seating arrangements. Because if we find out that that's why this resident is angry, can we solve it? Yeah. But if we focus on C, are we really validating that feeling? And validating doesn't mean we want them to stay angry, right? It just means that we're like, I completely understand. Can you tell me more about what happened? What has you angry? Right? And you can always be at a distance, but I definitely understand. I didn't even look at it that way. The closely part, how you're like, wait, I need to keep myself safe. So I definitely get that. So in this case, without adding aggressiveness in that scenario, take that out of the wind, take that out of your mind. Do you now think A would be a better response? Awesome. Did that help, Martha?
Yes, ma'am, that helped. I was just thinking about angry, but
Uh-huh.
is there no aggressive? You're right.
That was very good. I mean, it's a very good point too. I know you've been in the industry before that we do experience aggressive behavior. So I definitely totally get that. Very good. All right. While the nurse aide tries to dress a resident who is confused, the resident keeps trying to grab a hairbrush. The nurse aide should A, put the hairbrush away out of sight. B, give the resident the hairbrush to hold. C, try to dress the resident more quickly. Or D, restrain the resident's hand. What do you think is the best response for this one? We can use some keywords. This resident is confused. Their action is they're trying to grab the hairbrush, sorry. What should we do in response to this? What answer choices can we eliminate? All right, we got A and B. Awesome. So A says we're gonna put that hairbrush away out of sight. B says we're gonna give the resident the hairbrush to hold. We eliminated C, which is try to dress the resident more quickly, which I agree, like that, I don't know, when a resident is confused, trying to do something more quickly can actually cause them to be more fearful. They may feel like things are unpredictable, so they may start pushing away. So we don't want to necessarily create a different scenario, right? And we know D is just not an option because we're not restraining a resident in any way, shape, or form. So again, these are two good options. And let's see what makes the most sense here. All right, let's bring dignity to this resident, right? We do know that the resident is confused. And I think even putting that there could confuse us on how to best answer this. Because I think immediately sometimes we think confused, we can think incompetent, we can think that the resident needs to be almost like handheld, almost like a child. Because we got to keep things out of the way, keep things safe. But I want us to think through that. Let's say this resident is 69, they're older, right? Yes, they have confusion. And maybe this is a diagnosis where they are confused every day. What is the best option that we're going to preserve dignity, right? Because we're not dealing with a child that's trying to grab a knife, right? Or a fork. And the resident is not even trying to grab a knife or a fork, which would be a safety thing, right? This is a hairbrush. This is their hairbrush. So what would be the best option to preserve dignity in this scenario? So let me see what you think about it now with that thought process. Very good. B, right? We're gonna give the resident the hairbrush to hold. It's not saying that the resident's trying to hit us with the brush, where it would become something like a weapon. They're not trying to throw the brush across the room, hurt themselves, maybe like stab their hand with the brush, which would also make it more weapon-like. They're just trying to grab the brush. So I know for A, that makes sense if they were doing the things that I just described. They're trying to hit you with it. They're trying to throw it across the room at someone or something. They're trying to hit themselves with it. So they're confused to the point of almost harming self or others. Then yeah, we're going to do A. We're going to take the brush, put it away because it's now a safety issue. But B, again, brings dignity back. And it's like, okay, you want this hairbrush? Here you go. I'm gonna go get another hairbrush and brush your hair while you're holding the brush, right? Does that help kind of determine the difference? So what I think I'm seeing is that it's easy to add to the scenario and make it bigger than what it is. So just try to keep it there. It's like, okay, how do we preserve dignity? Is the resident at risk? It's not a knife, it's not a spoon, because even a spoon can be dangerous. I've seen it. If they're trying to throw it, they're getting aggressive. If we see those words in the question, they're combative, they're aggressive and confused. They're grabbing the spoon. Maybe we would, depending upon the choices we had available, we might not do B, we might do A because we want safety. We want to do it from a safety standpoint. But here it's saying that she's confused, which I think kind of distracts us a little bit and it takes away dignity and from the scenario. Because if I'm trying to grab my brush, what if she wants to brush her own hair, right? And we're just like, oh, let's just put it away. We want to just give it to her, let her hold it. And I like that it says to hold. There's nothing unsafe about her holding that brush. So I hope that helped with that. Awesome. An exposure incident requires that specific steps be taken, which includes the following. A, the nurse aide should report the incident to his supervisor at the end of his shift. B, the nurse aide should report the exposure immediately to his supervisor. C, the nurse aide should leave the facility to get testing done at his doctor's office. Or D, the nurse aide should leave the area immediately and warn all residents that he sees not to go in that specific area. I didn't realize it was cut off, but what say ye about this scenario? Awesome, we got B. Very good. The nurse aide should report it immediately. And then guess what? You know, that's the first thing to do. And then they may tell them to go to the doctor's office, depending on the exposure. We don't know what it is, so we're not gonna add too much to that, but we can see why B is the first thing to do. And that allows us to eliminate these other options. Very, very good. When moving a resident up in bed who is able to move with assistance, the nurse aide should A, position self with knees straight and bent at the waist. So positioning that resident with knees straight, or yourself, I'm sorry, positioning yourself with your knees straight and bent at the waist. B, use a gait belt or transfer belt to assist the resident with repositioning. C, pull the resident up holding onto one side of the draw sheet at a time. D, bend the resident's knees and ask the resident to push his or her feet. Or push up with his or her feet. What do you think is the best thing to do? So remember, what is this resident trying to do? They're trying to move up in bed. And they're able to move. So this is a key also. So this is not a bed bound resident. This is not a resident who's contracted or stiff. Awesome, we got an answer. We got B up here, so I'm gonna circle it. And we're just trying to move the resident up in the bed who is able to move with assistance, the nurse aide should. So that means this resident is in what position? What position is this resident in, and what is our best way to get them up? All right, we got C. All right, and we got C. Pull the resident up holding onto one side of the draw sheet at a time. All right, let's go through it. So A, we didn't put that as an option. It says position self with knees straight and bent at the waist. So can anyone tell me, like, what type of assistance would you think we would provide if we would do A? Like, what would we be helping the resident if we position ourselves with knees straight and bent at the waist? What would we be doing typically? It almost looks like we would be lifting the resident, right? It just, it doesn't add up, just to help with that one, right? It doesn't have, like, they're laying in the bed. They're not saying that they are, but we wanting to move them up. So we know that they're probably laying on their back. Because it says the resident is needing to move up in the bed, and this resident is able to move with assistance, okay? So this just doesn't make no sense, all right? B, use a gait belt or transfer belt to assist with repositioning. Can you let me know, both of you, what situation would we typically use a gait belt? What type of assistance would we be providing? You can get off mute if that would help. What do you think? What type of assistance? When should we use a gait belt or transfer gait belt?
When they walk.
When they walk. Yes. And what else? There's another situation. Very good. Definitely when they're walking.
Yeah, transfer from bed to wheelchair.
Definitely. And transfers. Perfect. So let's go back and reread the question. When moving a resident up in bed who is able to move with assistance, the nurse aide should. So would this be a scenario where we would use a gait belt? Rereading that question. Are we walking the resident? Are we transferring them based on the question that we have available? The answer is no, right? So in this scenario, we are not going to use a gait belt. We're going to typically have it when we're lifting, transferring, or walking. And in this case, we're not lifting, we're moving them up in bed. So just kind of get that visual. Let's say you're laying in your bed and you somehow scoot it down. What would you do to try to move yourself up in bed? What would be the easiest thing for you to do? Look at your answer choices. I'm going to take off my scribble here. Imagine that you're laying in the bed. What would be the easiest thing for you to do? Because remember, this resident is able to move with assistance, right? So let me know what your choice is now, thinking about it. We're definitely going to eliminate this one. And we've already clarified when we use the gait belt. So I'll leave C and D as our focus for the two. All right, we got D, very good. Some awesome. So C says we pull the resident up holding onto one side of the draw sheet at a time. D says bend the resident knees, ask the resident to push with his feet. Right, so just imagine I'm laying down, bend my knees. Am I able to scoot up in bed if I'm able to move with assistance? Or is it better for the nurse aide to grab one side of the draw sheet, which is like your bed pad? It could be a sheet that's folded. Is it safe for me as the nurse aide to only have one side and pull that resident up? Is that the normal way we would move a resident up in bed? So what are your thoughts? Let me know if you change your mind on your option. Put it in the chat box. If you want to talk through it, clarity, let's work it out. That makes the study time.
Well,
Okay, I got
the drag sheet, that's supposed to be, that's why we used to pull patients up. We need two persons.
that's correct.
But yeah, but D, I mean, they can be unsafe for the patient, and that's my thought, because they can hurt the knees, or they can hurt the skin. I mean, see, they're dressing, that's fine, but see, they're like with the gown, uh they can be, rub the skin.
I totally agree, actually. Everything that you said is fully correct. I'm gonna reread C though. And so you said, let's go back to one of the things you said, and everything is true. You said that how many people should be using the draw sheet to pull the resident up? Should we have one or two?
But I mean, yeah, they don't mention about the second person. Yeah.
Exactly. So that's the only thing that makes C wrong. You
Yeah.
described it to the T. You're right. Like, that's exactly why the draw sheet is there, to lift that resident up in the bed. But what makes C incorrect is that we're holding one side of it. So we can hurt our back. We need a second person to make that safe for us. But everything you said was correct. Every single thing. Well, why do we use it? What the safety risk of them even pushing up. But looking at the best option, let's take away C for now. Does any of these answers, Are they the best option? I think D is your best option based on what we have available on the test. Does that help?
Yes, thank you.
Mm-hmm. And I love how you broke it down. So I would go back, if you had a question like this, I would go back and reread it and say, is there anything wrong with this question, this answer, sorry. And even though D could, like you said, especially if their skin is real thin, it can cause a skin tear. You know, all of what you said is very, very true. Nothing about it was not. But this whole situation with this one side made it unsafe for us, literally. So that's what made C not the best choice, that one part of that. Because you're right, we should have two people on each side, grabbing each corner, counting to 3, and lifting that resident up in the bed. Very, very good. And this is how I feel like the questions can become very tricky for us, right? Because it's like, that's the whole purpose of a draw sheet. Yeah, we have it there, not for decorations, it's to make those processes, even turning the resident. We can use the the draw sheet to turn them towards a different position, change their side. So you're right, very right. Very, very good. All right, before helping a resident into a shower, the nursing assistant should A, test the water temperature, B, massage the resident's head, C, soak the resident's fingertips, or D, exfoliate the resident's skin with a brush. Wow, this resident is having a spa day, huh? Before helping a resident into the shower, the nursing assistant should A, this is actually a safety question. Because we don't, everybody's water temperature is different. So testing it, even having the resident test it before you immerse that resident in the water is the safest thing to do. Very, very good. When a sink has hand-controlled faucets, this is similar to what we have is literally what we have at the school, because that word hand control seems so weird for some reason. But when a sink has hand-controlled faucets, the nurse aide should A, use a paper towel to turn the water on. B, use a paper towel to turn the water off. C, an elbow, if possible, to turn the faucet controls on and off. Or D, use your bare hands. I think you should be able to glean to one of your skills for this answer. Awesome, we got BB. Very, very good. Yep. Use a paper towel to turn that water off. Very good. Which of the following, if observed, is as a sudden, I'm sorry. Which of the following, if observed, is a sudden change in the resident and is considered a possible warning sign of stroke? I hate the way that's worded. So which of the following is a sudden change in the resident and is considered a possible warning sign of a stroke? A, dementia, B, contractures, C, slurred speech, or D, irregular heartbeat? Very, very good. Slurred speech is correct. So knowing the signs of a stroke is going to be very, very, very important to answer a question like this. Awesome. You got to the end. I hope that these questions actually helped We had a few that we were actually having to think a little bit more about, take out our own imagination just to help us get to that. So I hope even going through this help you with questions that you're going to see on your retest and on your test to try to decipher what is the right answer. So I want to go back to our test taking strategies, which is read all those questions at least 3 times, or like Dulce says, read your answers first. Ask yourself, what is the question asking you? Eliminate anything that is obviously incorrect. Try to focus on answers that promote safety for you and the resident, proper hygiene and infection control, resident independence, and always tell your nurse. And remember, when we have a tell your nurse question, as we saw yesterday, you want to make sure that there's not something, if it says your best action, see if there's an answer option on something you can do first, then call the nurse. Like we had the fall incident yesterday, and the first thing that you could do, or the best thing, was to check for injuries. We know we're going to be talking to the nurse within 5.2 seconds of that. So just pay close attention to that, because some things are exactly what, sometimes they're exactly that. It's you doing the best thing, and or is this a scope of practice where this is a nursing task, like our wound care situation? 100% of the time, the answer is to always wash your hands before and after. I'll add that you do any care task. I think one of the key tools that we're going to add to that today that we saw in our questions is try to read your question and don't add any other details to it. I added some details because I wanted to help you get to the answer and think through it. But notice, if you add any scenario, sometimes it'll cause you to choose a different answer. So just try to review it again and say, okay, wait, is this even the scenario that's in front of me right now, right? Like the brush, right? Is this just a resident grabbing their brush outside, take away confusion? Yeah. Or is this a resident trying to stab me with the brush, right? 2 different scenarios, 2 different responses because of the different scenarios that are presented. So this is very, very awesome. So since we have, let's see, I gotta decide how we're gonna do our gift today. All right, and I'm gonna end our recording part, but please stay on because we do have to do our giveaway.